every single practitioner has the first stage, get you out of pain, increase range of motion. Once they have you out of pain, you're out of there. Pain is the metric to them. That's not the metric to me. Being able to throw her grandbabies onto the trampoline, being able to get down on the ground and up off the ground without having to find a tree, that's the metric.
All right, welcome back to Straight to Health. My name is Dr. Hall. I want you to learn something new in this podcast. I hope in my previous episodes you have done so. This episode, I'm kind of changing it up. I know that last episode I had mentioned that we were going to move up to more injuries in the spine because we finished up with the hip. But I actually want to mix things up and see what the listeners think about bringing on more guests. I had more response and positive response from guest speakers and the interactions that I've had with them. So today, I brought on a good friend of mine. His name is Dr. Derek Huddleston. Say hi, Derek.
Hey everybody! Thank you for having me, Gavin.
You're very well. I'm glad that you're here on this show with me. The goal of today is to show you how there are many different types of chiropractic, and we can all be successful. So he's out in Arkansas. Go ahead, Derek. Tell us, Dr. Derek. Tell us a little bit about you and your practice.
Yeah, I am a one-on-one chiropractic sports physician. I focus on helping people unravel. I focus on helping active people stay healthy and mobile by unraveling the root cause.
Yeah, the root cause. So we all like to say root cause in chiropractic. Why did you choose chiropractic?
We hear it a lot in our field. I didn't choose chiropractic. Chiropractic chose me.
Okay.
The story goes, may I tell about a 5-minute story here?
Bring it on, please do. We want to get to know you.
Back in 2006, I was in my mid-20s. I was a very highly decorated airman, and I had just been accepted into special operations school. I had been one of the fittest people on the planet, and I was ready to rock and roll until I wasn't. Everything changed with a series of injuries. In a matter of 5 years, I went from being one of the fittest people on the planet to special operations school to I've had 11 surgeries. I'm medically retired from the military. My best friend died in a car crash. Another friend killed himself because he couldn't deal with Iraq anymore. I'm addicted to opioids, and I have a severe alcohol problem. When I was trying to go back to being active and healthy, I got more pills, I got more injections, I got more talks of needless surgeries. When I would go to PTs, I got real low level exercises. And I was, as a 29-year-old male at that time, I was doing the same things as like a 70-year-old female. She needed to get on and off of the toilet. I needed to get back to being physical because that's who I am. That's who I was. Well, that's who I am. I found a chiropractor here in Arkansas, and he actually exposed me to true health and wellness. I went back to Afghanistan as a contractor, and I was over there a year and a half. I came back, and I had a complete emotional, physical, psychological, spiritual breakdown. I was going to go to PA school, and I decided I can't go into a system that pushes pills. Okay. And I didn't know what I was going to do. And then God spoke with me, and he's like, hey, dude, you got to become a chiropractor. That's what you got to do. You can't push pills there, and you can use the body's innate healing system. So I went to chiropractic school. And just to go a little bit further, I found that traditional chiropractic didn't work for me as a practitioner. And what I'm saying is, once I was in a clinic in Dallas area, and just me alone in a 12-hour day adjusted 70 people.
Yeehaw.
Yeah. And to me, that wasn't true healing either. So from when I was working in PT clinics as an athletic trainer to high volume chiropractic, neither of those, they were treating the insurance and not the patient. Neither of them felt good on the inside. So I just had to do what I was called to do and open my own practice that combines holistic healing and sports medicine. That's why I say the root cause. A lot of people talk about the root cause, but listen, sir, like I can snap your back and you're going to feel good for a day or two. But has anyone ever evaluated your squat or your deadlift? Because A deadlift is how you pick up your grandkids. A squat is how you get on and off the toilet. So we start to program today so that you don't need devices to get on and off the toilet when you're 70.
Right.
That's what I mean by the root cause. Is it neck? Is it hips? What's leading to the low back pain?
Yeah, well said. I have it very often in my practice as well. Do you have this experience where people will say, well, I just don't want to keep coming back to you as a chiropractor over and over again because that's what chiropractors do?
Oh, I hear that all the time. That's one of the biggest complaints we have, isn't it?
Yeah, I would agree. How do you respond to those typically?
Oh, I have a program.
Okay.
We know based off of data and what my previous patients have told me, usually how a body will respond. So you probably get the same thing. Most of my patients are like out of pain by appointment number 6, out, done. I do believe in wellness adjusting. I do believe in that, a checkup now and then.
Sure.
But for someone to say, hey, you got to come back once a week for the rest of your life, that's holding them hostage. And to me, that takes away the person's autonomy. I believe in autonomy.
Yeah.
So I say, here's the beginning, here's the end, here's the start date, here's the end date, based off of what we found and how you're responding.
Sure.
That's how we know the treatment plan.
Yeah. Yeah, I agree 100%. What bothers me is, so I heard it just today, actually. I had a patient came in, they say that it was a new patient. They said, this isn't different. I actually, this is different. I actually been told by many chiropractors that I have one leg longer than the other and that to get them straightened out, they will never straighten out again. So I just have to keep coming so they can level out my hips.
Mm-hmm, mm-hmm.
My response is typically something to the effect of, well, if what you're buying is your longer leg, everyone needs it. Because in my experience, I don't think a patient has come into my office where you don't have some sort of functional imbalance. If your glute tightens up on one side, you're going to have a shorter leg. If you have a tight quad on the other side, if your abs are tight, you know what I mean? Any tightness in a muscle can really change how the entire joint and then the sling down the leg or the relationship with the muscles around it changes how the rest of the chain goes and moves. And so I typically will say something to the effect of, if what they're selling is the long leg, let's find someone who can do a little better.
Yeah. Yeah. I thank you for saying that. I'm going to try to adapt that into my practice. I hear that a lot. Well, I've got one leg longer than the other. I typically respond with, yeah, we've all got stuff like that.
Yeah.
And that may be minimizing it to the patient, that may be minimizing it. And they're like, but I've been told this by every chiropractor I've seen.
Yeah. And although it might be true,
yeah,
there's a better way to do it.
I go along the same lines as you. The functional, it's more of a functional thing versus your bone's not actually shorter.
Yeah.
It's just telling us how the pelvis has shifted.
Right. And maybe sometimes I'll add did you get your knee replaced or your femur, your head, the hip replaced or anything like that? Because typically in surgery, they should measure your bone. They'll chop off a portion of it, do the replacement with the metal, and then they'll say, okay, let's make sure we're something close to the similar length that we started with.
Mm-hmm.
In those cases, I'm like, yeah, maybe you could have a genuinely short leg. Or you had a disease when you were younger and it stopped you from growing. And sure, maybe you can have an infection. There are certainly exceptions to the rule. But as a whole, I'm like, okay, well, let's think of something else, shall we?
I agree with you. And most people don't have a short bone. They don't.
Right. But I'm curious, you mentioned that you like to focus on the functionality of the patient. Tell me more about the style of practice that you practice with.
Okay, so my experience, I have 24 years experience in being an athlete, strength and conditioning, athletic training. And with all of this experience, I see your meat suit. It's not that I don't love you, but when I look at you, I see like the bones and the muscles and the pulleys, and my brain just works that way.
I totally can relate to you. Sorry, continue.
Yeah, the military paid a lot of money to figure out that I have a high spatial aptitude. So thanks, Uncle Sam. But when I look at someone, you could just go, that ain't right. Here in Arkansas, that's what that ain't right. I don't know why, but then that's my job to unwind that over time. So if someone I treat a number of golfers, okay? A number of golfers. I treat a very high level professional golfer. I treat golf pros all around. And they will come in with low back pain. They've been to PTs, chiropractors. I'll shift for just a second. Most of my patients have been to several chiropractors and PTs, and they come to me skeptical. So I'm always appreciative of skepticism.
You got some splaining to do typically?
Yeah, because they've been sold snake oil.
Yeah.
Let's be honest here. That's a lot of people will sell high volume, high packages, and then the results aren't there, unfortunately. So if we have a golfer, I have a golfer named Jason. He's been playing since he was 12. He's had 40 years of low back pain. No. 40 years of low back pain. 2 weekends ago, he played golf with his son the weekend that his son graduated from a local university. That's the first time he swung a golf club in 3 years without back spasms. How did we get him there, Gavin? Sorry, Dr. Hall. When he's been to chiropractors, PTs, they adjusted his lower back. They had him do some exercises, right?
Yeah.
I've got to do this. Everyone is going to have you do these exercises for your low back.
Thank you for that. That's great.
You're welcome. Right. You get a few cat camels, you get a few of those, and you're good to go for a month and a half.
Yeah.
No one had ever watched him swing his club. No one had ever watched to see what the follow through looks like on his hip. So if this hip is locked, Doc, if this hip is locked, where's the motion going to come from? Where's it going to come through?
Above and below.
Up here.
Yeah.
So then, you've got a low back problem. Let's fuse those two together, Doc. That's the issue. That moves too much. So let's put some metal in there. But they still haven't addressed this.
Right.
So where's it go? 3 years later to the next segment, another piece of metal. And that's what I mean by root cause. That's how I take my anatomical approach. Once I unlock the things, obviously I'm passionate about this. I love this. Once I unlock the things that are stuck, I stabilize out there in what I call the strength lab. I get the muscles that are turned off to turn back on. And do I have it close by? I have something called a neuraxon. It's a surface EMG. So I get most people don't know how to connect their brain with the muscles that have been turned off. If someone has chronic low back pain for 40 years, you think he has connection with those muscles? No. So what we'll do is we get him with visualization, with some of the cool, fancy $4,000 pieces of equipment. We get him to visualize. And then once he goes, that's what it's showing me on this screen here, that it's activating. And now I feel it. I should have been feeling this for 40 years. Today's the first time I've ever felt that. And then now that his body has made the connection with those muscles that have been turned off, voila, we unwind it and then it becomes magical. Very similar to your aim it, right?
Yeah.
Very similar to what you're doing.
Same goal.
And that's the beauty of chiropractic. We can turn it into anything we want because the body is so powerful. Listen to me, people. The body knows what to do. I call it God. Once we remove the interference, I call it God. God heals. Okay. That's the thing working through it.
Yeah.
The body is going to do what it's designed to do. You've treated me before. I couldn't believe your wizardry. This is the way I do it.
Yeah.
But in my opinion, I snap your back and I send you on the road, see you for infinity. That's incomplete. And that's taking away a patient's autonomy, and I don't like it.
I agree. So the way that I think the goal of treatment is the exact same, in my opinion, based on how we treat. The end result is we want muscles to do their job better so the joint can find its own stability.
Beautiful.
Is that accurate to say?
I wouldn't put it that way, but that is beautifully put.
Because
I learn a lot from you every time I speak with you, sir.
No, because I have people that are like, well, it's explained to me with the chiropractic stuff, the subluxation. Okay. And how the joint misaligns, that pinches a nerve and that causes problems. And if we can just free up the joint and get the nerve unpinched, then we're good to go. But if that, in my opinion, was as simple as the issue is, then why do you need to come back for more? Well, because the misaligned again, that bone misaligned again. So we have to do the same thing. We're going to straighten it back up. We're going to relieve the pressure from that joint. And, it's this what I would consider a repeat visit every week until eventually your body just remembers that's where it's supposed to be. And that day is the day that you finally find relief. And it might be tomorrow, and it might be 7 years down the road, or it might be never, but you're going to come regularly, because that is the goal of what we do, is to make sure that joint stays put. And the reason why I think I got into what I do is because my brain went, well, structurally speaking, muscles are supposed to hold that bone there.
Yeah.
So if the bone keeps shifting out, why don't we make sure that the muscles are doing their thing, right? So anyhow, I kind of stole the thunder from what you probably could have said as well, much easier than I would have.
It's more, you know me, I tend to use more words than necessary. Remember, I even spoke with you about AIM-IT.
Yeah.
And it was COVID time, and they took it down, and they weren't offering it at the time I was ready to take it.
Sure.
But it is really, really useful. You and I see that both the same way. A lot of the times my patients don't have any control of the muscles, we know what we're talking, multifidi and quadratus lumborum and all these things, but these small rotatory muscles, these small muscles that are responsible for stabilizing the spine, they have no control of them, and they really don't know how and when to contract them, and should they be, let's say, I have a patient, he just started with me. Today was his third or fourth appointment. He's been going to Infinity chiropractors, right? And he's like, yeah, my hip's out, and my L5's out. Bless his heart, he doesn't even know what that means. But he's like, can you put it back in? And I'm like, where'd it go? Is it in Dallas?
There's actually, so Dr. Charette, for those who are listening currently, Dr. Charette is the mentor, the chiropractor who we learned all of our adjustments from. Dr. Derek and I went to school together. I forgot to mention this in the beginning. We graduated together in the same, relatively close together. That's actually a great story that I might share on a different podcast episode, but I think it does need to be shared because it's hilarious. But we started in the same class together, Dr. Derek and I ended up graduating about 3 months after he did, but that's a great story probably for another time. Anyhow, back to Dr. Charette is the gentleman who's going to be on our next episode. He's an old chiropractor who has done a lot for chiropractic, the profession, each of the healers that the chiropractors have become. Please tune into that one as well. It's going to be a fantastic episode to kind of give us a little bit of wisdom on why and how he has influenced the chiropractic profession so dramatically, in my opinion, and changed the standard of what even chiropractic should be. If you just go in and get your neck and back adjusted, that's not enough, according to him, and I agree with it. So please tune into our next episode. But sorry, back to Dr. Derek. I apologize for that tangent.
No, I love tangents. You know that. Dr. Charette has not only impacted you and I, but think of how much he's impacted our patients who we've treated. Agreed. So he's impacted so many people he will never, ever meet, and he doesn't know.
Yeah.
He's a legend.
Mm-hmm.
I forgot what I was doing. What am I doing with this thing?
I can't remember.
All right.
We'll move on to the next topic. So when you treat someone, you were talking about, you have a start and an end to your treatment plan. What do most people look for in that treatment plan?
Oh, that's a great question, Doc. What they're looking for is pain relief.
Sure.
They think.
Yeah.
And then we start asking them more questions. One of my core values in my practice is seek understanding. Mm-hmm. The reason that is the better I understand someone, the better I can serve them. Okay. I ask a million questions to better understand them so I can better serve them. So let's say remember, I'm in the South, so we don't say grandchildren or grandkids. We say grandbabies, okay? I have a lady, she's in her 60s, early 60s, and she started a 5K program, and she's getting knee, hip, low back issues. And she just wants to wants to be out of pain.
Mm-hmm.
I'm like, okay, how does your day change if you're out of pain? Well, I can do my training. Okay, you can train for your 5K. Great. So what happens if you can train with your 5K? Oh, then I'll feel better when I get home and I can play with my grandbabies. So how's that going now? Well, actually, when I get home, I have to sit and watch more than I actually get to play. And I want to be able to get down on the ground. It's a beautiful time of year here, grass. I want to get in the grass and play with my grandbabies and throw them on the trampoline and these things. Okay, so what are some things that we could do? What are some things that we could do that would help you feel confident that you can finish the 5K, training the 5K, so that you could go home and be present with your grandbabies? Well, we could do X, Y, Z. Okay. So really what she came in for is quality of life. But that is disguised as I want to be out of pain.
Right.
But really what she wants to be able to do is life activities. And right now in her life, it's a 5K. It's playing with the grandbabies. It's being able to throw one of her younger grandkids on the trampoline, apparently, which I'm cool with, because that turns into a rotational movement, right? So we have to build resilient muscles around the spine and help her understand how to move a load. I watched her run. I watched her do what's called a deadlift, which is just a certain kind of movement, in a single leg squat. So let's say, Doc, you know about these muscles. We have these muscles on the side of the hip here, and they come from here to there. If they're weak, that's what happens. However, when we're walking, that's not going to happen. What will happen is the knee goes inward. So the knee will dive in, and that's called a valgus collapse. That causes a storm of problems up and down the spine and the knees and all that. So it could be manifesting as low back pain, but when I watched her do a single leg squat, I could tell that these muscles weren't activating correctly, in which nerves go to that muscle group. They come from here. And then we also found that these bones up here were just stuck because this is hypermobile. That's stuck to protect this area. Mm-hmm. This is moving too much. So this is stuck. So I move these, I stabilize these, I get these activated correctly. Bada boom, bada bing. Before you know it, she's up there running 5K, throwing the kids or grandkids on the trampoline.
And how long before she was out of pain versus how many visits she had left in your treatment plan?
Oh, most of my patients are completely out of pain by appointment number 6. And with her, she needed 15 visits.
Okay. How do you explain that further, that you need more visits then?
Beautiful. I knew that was the next question, because I'm not holding anyone hostage. When I communicate with my potential patients, I help them understand that I can adjust them and they're going to be out of pain. We are going for long-term solutions. And in my program, I call it the route to resilience method. In the route to resilience method, we have 3 stages. Every single practitioner has the first stage: get you out of pain, increase range of motion, that kind of stuff. In my program, so once they have you out of pain, you're out of there. Pain is the metric to them, right? Sure. That's why pills work. That's why quick fixes work. That's why injections, repeat infinity chiropractic works, because it's very effective at getting them out of pain. And that's the metric. That's not the metric to me. Being able to throw her grandbabies onto the trampoline, being able to get down on the ground and up off the ground without having to find a tree, that's the metric. And I have to communicate that with the patients. It's not easy, because they've been, forgive me for saying this, but they've been trained to want to be out of pain.
Well, that's what the advertisements in every drug commercial you see is.
Yeah, your erection hasn't gone down in 4 hours? Call your doctor.
But you're right.
You need to see someone about that.
Yeah, I think you're right, though. It's what they've been trained. They don't know. They don't understand. We've never been taught. You don't learn it in school, right? You don't learn it in high school. There's no job that says, oh, yeah, we got to make sure you're working well, other than we got to put in your hours. those UPS workers and all the mail delivery people, they're just out there. They're never told how to lift a box correctly. Am I wrong?
No, I was. You're 100% right. And let's go into story time.
Bring it on.
I was written as an athletic trainer. I was working at a PT clinic in Washington State. I was written up my third day there, my third day for overstepping my bounds. Here's the story. I was speaking with a delivery truck driver. Igor was his name. He was an immigrant. His wife, kids, and parents lived with him. He was the only income. They were from more of a traditional background. And anyway, he had numb toes. They had him doing the same old clamshells over and over and over. He had been there, he told me, 12 weeks, and he was about to end the plan of care. Why? Insurance treats for 12 sessions. Mm-hmm. Okay. I actually took him over, and I had a bench, like a weightlifting bench, and I put it here. And I said, Igor, do me a favor. And I took a basket, and I put 10 pounds in it. And I said, if this is a box that you need to pick up, and this bench is a box that you have in your way, show me how you would get that. And no wonder his toe was going numb, because his spine was bending and he had really bad positioning. He had no idea how to strengthen or how to engage the correct things. So the box is a deadlift. Sure. I'm just going to use that term.
Yeah.
He did not, after 12 sessions, he didn't know how to move properly. After that one visit, he knew how to lift more properly. And we have to teach them how to move better, because they're going to continue to do the thing that got them there. And that's why when I get someone out of pain, that's when the real story gets going, because they're not in pain, so we can push them further. Hurt doesn't mean harm. If there's a 3 out of 10 on the pain scale, we can push through that. That's okay. The motion, the body's designed to override motion anyway, right? What happens when you stub your toe?
Keep walking.
You dance a bit, don't you?
Yeah, sure.
Yeah, may even but that's because we understand the nervous system is designed to override pain. But that whole rant started because of the box thing. We have to teach them how to move properly. And that's why I practice the way I do. That's why I have the program that I do.
Yeah. Well, then you mentioned a bunch of exercise and things that you do. What makes you different than a physical therapist?
That's a really good question, because a lot of people will compare me to a physical therapist.
Well, I would say rehab chiropractic, and forgive me if that's the wrong terminology for using. I believe it's a style of rehab chiropractic. Mm-hmm. With the exercising. A lot of people say, well, rehab chiro is just the same as rehab with a physical therapist. How is it different?
That's a beautiful question. I'm so glad you asked. A lot of it has to do with philosophy.
Okay.
And my practice in particular has to do with the level of questioning. When we think about the system, I believe our healthcare system is broken.
I think most chiropractors would sing that with you.
Mm-hmm. And a lot of people know it. They just don't know what to do. It's just you and I had the gumption to go out and do what was best for the patient.
Sure.
But since the patient has been marketed to for so many years, they think pain is the only metric. We are fighting an uphill battle.
Yeah. But
more people are becoming aware of how dysfunctional our system is, and they want us. Our patients, this podcast, the people who believe in what we're doing, we have to be ambassadors for our practice and help people find us. So what makes me different from a physical therapist? A lot of it has to do with the level of questioning, and then the philosophy behind it. Most physical therapists do not believe in the healing capacity of the body the way that we do. The way I see it is the muscles have their job. The nervous system is king of the muscle. Breath is king of the nervous system. Our nervous system has to be right in order for the muscles to do their job correctly. When I adjust someone, that's one of the most powerful things that I can do. But now that their nervous system is communicating better, when I get them out there doing the exercises, the muscle is actually activating more because the nervous system connection to it is better. The other one is the level of questioning. Excuse me. The level of questioning comes to, since they're in the system, they're incentivized by volume. When I was in network with all the insurances and I was working for a different clinic, even though I knew what was wrong with the patient, I had 5, maybe 10 minutes with them. I couldn't do the deep diving that really is needed for true healing.
Mm-hmm.
Now, clearly it's high volume, high pressure out there, right? High stress. And now I spend an hour with every single patient. That allows me to ask a lot of questions, connect with my patients, because there's the biopsychosocial modalities, right?
Mm-hmm.
When we make these genuine and healthy connections with our patients, healing comes from multiple angles. I just happen to use the strength lab and 24 years of experience of being an athlete, strength and conditioning, athletic training. That's just the other portion of it. Chiropractic is extremely powerful, but it's incomplete a lot of the times. A
lot. Well, so you mentioned then, I'm going to ask this one.
Ooh, is it juicy? I like juicy questions.
This is going to be a good one, because this is a complaint that I get often. It's asked in my clinic as well. Mm-hmm. They'll say something to the effect of, why are you so expensive?
Mm-hmm. What's your answer?
So I want your answer first, and then I'll give you my how I like to answer that one.
Am I answering the question to Dr. Gavin Hall, or am I answering the question to the patient right now?
To a patient right now. This is what you would say to a patient.
We've got a car. It's on sale for $5,000. Is that expensive?
What year is it?
There we go. What year is it now? 2025. So it's a 2023.
Okay. That seems like a good deal.
Okay. It needs transmission work. It needs an oil change. All the tires are flat.
Maybe less so, but I guess the value of the car depends on that. Does it have the potential to be $15,000? Because if I can put $2,000 into it.
Okay. It has a blown engine.
Okay. So now it's not great value at all.
And now it's in the junkyard.
Sure. $5,000 for a piece of junk is expensive. Yeah.
Okay. We've got a 2023 Lexus. And it's a very nice Lexus. Okay.
Everything's working.
Everything's working fine.
Okay.
We just happened to get a steal because it's a retired colonel on the Air Force Base. And he just retired from being a pilot. And he just wants to sell it. And he's really got a good heart. And he's like, I just want to hook up an airman. He's selling it on the Air Force Base. He's just really trying to give a really good deal to a younger airman. Is it expensive?
Have you said the price yet?
$5,000.
Oh, okay. No, that's pretty cheap. That's super cheap.
That's valuable. That's a great value, isn't it?
That's a great deal.
It's about the features. By the way, that's how we got a very nice vehicle for my wife.
Hmm.
We didn't buy a Lexus, but it was another higher end vehicle.
Super
we got a steal from a retired colonel. It's like, I barely drive it.
Wow.
So to a patient, what's more valuable? Getting adjusted the rest of your life, or coming in for a set treatment plan, knowing a beginning date and an end date, and actually more than the appointments, you actually have communication with the doc. You have access to his brain. You have someone who's going to guide you along the journey versus see you next week for infinity.
Yeah.
Which one's more valuable? Which one's, the one that has the blown engine that you need a lot of work to maintain, or the one on the Air Force Base?
Well, in the Air Force Base, definitely more
It's
valuable.
and that's how it is.
Yeah,
Why am I so expensive? You're going to pay more for a Lexus than you will a beat down Kia. When when I since I'm not worried about volume, I can do the research for my patients. I
sure.
have a 16-year-old patient, and he's trying to make it. He has people scouting him already. He's a lineman,
Hmm.
and he already had excuse me already has D1 colleges
Wow.
scouting him. He's been to two PTs and a chiropractor. How much money do you think he spent, or his mom has spent? It's a lot. They told me the number. It's a lot. We've done more in this practice in it has been 11 sessions. We've done more in 11 sessions than he has done with three other practitioners,
Yeah.
based off of the level of questioning and then how powerful chiropractic is.
Yeah. And I would even add the
Which one's
time.
more expensive?
Well, I would even add the time that you're spending with him. Because typically the way that I like to answer that question is something to the effect of, well, logistically speaking here for the sake of business, depending on what it costs for your overhead, you're talking lights on, you're talking a building, you're talking all the things. I would say you need to be doing about $200 an hour, depending on the size of your clinic, to just keep lights on and make sure that the building is there. Now, for a standard chiro, I say standard, and I don't want to downgrade chiropractic because I do enjoy and it is very important. But I would say for standard chiropractic, they need to see high volume because their cost per adjustment is low. So then that means the time per patient is low because I need a higher quantity.
That's it.
So
And
if we flip that, we can try and complement the patient, really make sure they get the time that they're paying for. Sure, it is more expensive, but for the sake of keeping my doors open and you're getting a lot of value out of my brain, as you mentioned, the time that we spend, how specific I can be with your particular treatment, that it's a higher quality treatment. Back to your comment about the Lexus. I would consider this practice, your practice, a Lexus style of a practice, and you will get all the value that you're paying.
that's it. And one thing I need to work on is I often will say things about, hey, I got to run a business. But honestly, they don't care.
Sure.
They care about what's happening in their life,
Yeah.
which I can respect. I care what's happening in my life, or else I wouldn't be charging the prices, I wouldn't be trying to build this value in.
Yeah.
When I was in a high volume clinic, we were seeing 6 patients an hour, sometimes 8. It's just $45, $50.
I had a buddy actually who's working. He graduated with us. He was working at a well-known chiropractic franchise throughout the country, and he was adjusting 80 to 120 people a day.
A day.
But they charge $35.
Mm-hmm.
My complaint with that, my biggest complaint with that is you are now telling the world that to see a doctorate level professional, you can go for $35 and less than 7 minutes and go get a professional opinion on your pain. And that's downsizing, downgrading, downplaying, whatever word you want to use, the entire profession, in my opinion.
Let's turn this into stock trading, right? They've turned it into a race to the bottom and commoditization.
Sure.
If you want to, if you, I've always believed in quality. I've always believed in closed loop communication. And in that model, the wholeness of the person is set aside.
Sure.
And again, I obviously believe in chiropractic. I am one. But when we turn into a widget in a system, we turn into a cog into a system, $35 an adjustment, it really does It does not do a service to our profession, our level of education, all the work and the hours that we've gone through.
Yeah.
There are some people who want quick fixes. That's okay. I'm just not the right provider for them. You're not the right provider for them.
Well, have you even seen those patients who have come to you after visiting one of those quick fixes, and they're like, they made it so much worse?
Oh my gosh. I have an older gentleman, golfer, played rugby for 26 years. He has plates in his neck. He said they didn't x-ray and he just went to cranking on them.
Yikes.
Yeah.
Did they even ask him about
borderline malpractice?
I would agree. They should even, I mean, that should be part of paperwork. You should have read the paperwork at least.
My patient said he was scared that he was going to get injured.
Yikes.
On that chiropractic table.
Yeah. For any listeners out there that might have experienced something similar, tell the person to stop. If you are scared for any reason, way, or form of your life, you get off that table. Don't try and be kind about it. Just get off and tell them you're done with your visit.
Yep.
Find someone that will spend the time.
We don't have to be mean or nasty to set boundaries.
Sure.
We can set healthy boundaries by respectfully saying, I'm done. I'm done. Well, I'm not done yet. I understand that, but this isn't right for me. It infuriates me. When he told me that, I was infuriated.
Yeah.
That is irresponsible.
I agree. Well, back to that idea then, what cases have you heard of or maybe experienced in your office that haunt you?
Oh, Doc.
Uh-oh, was that a tough question?
It hurts my heart.
Oh.
And here's why. I've been practicing jiu-jitsu for a very long time, 13 years. Before that, I played rugby, and I'm a knucklehead. I love controlled violence. I was in the military. So a lot of people who are in violent sports and activities will come to me because of that.
Yeah,
I am that kind of person.
Yeah.
There was a guy, he came to me, and he was having like textbook discogenic pain that went into his glute. And herniated disc, we already know that he had an MRI. Great. We did the exam. I got him in there into the strength lab, and we did textbook, this is how you would help a disc.
Yeah.
Guess what? He responded like a textbook. Fantastic.
Good.
But I said, listen, I understand that this worked. However, look at what's happening in your abdomen and your hips. These things were what was causing to that bulging disc. I said, you have to come back. I recommend this many sessions. He didn't come back. I texted him. I called. I texted a few times. And then after that, I'll leave it alone. I'm not going to pressure anyone to be here, right?
Sure.
I saw him out in town about 6 months later. His goal was to compete at a very high-level jiu-jitsu competition I think it was something around 6 months later. And then I saw him around 6 months later, and he was like, Derek, I'm sorry. Cool. For what? Well, I didn't listen. You didn't listen to what? I heard your voicemail. I didn't call back. I read your text. I didn't respond. That herniated disc turned into a protruding disc, and he had surgery.
Yikes.
And the hardest part is, I honestly, if I can help someone, I feel unethical if they leave my clinic because I know what's out there.
But the next step is?
I know, because you fail conservative treatment.
Yep. And
once you fail conservative treatment, you're on the chopping block. And unfortunately, this guy, he was in his mid-30s.
By chopping block, he means surgery.
Oh, yeah.
Just for clarification. We're not going to kill anyone.
Yeah. If you fail conservative treatment, which is usually low-level PT and a few rounds of chiropractic adjusting, if you fail conservative treatment, then you're a candidate for surgery. Sure. And that's what happened with this guy. And bless his heart, he doesn't roll anymore. He doesn't train jiu-jitsu anymore. And he loved it.
Yeah.
And that hurts my heart because I know what the outcome could have been.
Sure. Yeah. Those are always tough ones. You make a recommendation and they get to the point of out of pain and they never finish the program. A couple other things that I wanted to bring up. I heard that you're writing a book.
I am.
Okay, what's it called? Tell me about it.
I don't have a name for the book yet,
All
but
right.
it's the point of the book is to explain why the practice opened, how our system is broken, the system is broken,
Mm-hmm.
and what it's lacking. And then, of course, there are some portions about my method and why it's different and how it's different, which emphasizes the program itself versus quick fixes.
Yeah. That's super cool. I don't know that I'll ever get to the point of writing a book.
You're doing a podcast?
I am doing a podcast. I could use
I admire
voice.
you for that.
I have to put my voice and my brain down on paper. I can just spit it out right now. I tell my patients all the time, like, I apologize during your visits. You might hear a slew of random fun facts, and I hope they help you. But whatever comes out of my mouth is accurate to the best of my knowledge. And I share fun facts about, like, your diet, how your body should move, and whether it's related to their pain or not. I'm spouting off all sorts of things about health because I'm really, I'm passionate about educating people about how their body works. And it bothers me when they're told, like, oh no, your hips are out of alignment and you need to come back forever. I'm saying, will you please? Oh, it bothers me. Physicians who are trying to make a buck bother me. And I just try my best to educate. So anyways, people will hear a lot of fun facts and random things out of my head. But the podcast is a lot easier because I can just spit it out. Writing it down on paper means I have to organize those thoughts, and that can be...
It's pretty hard.
I can't imagine.
But I've known you for about 8 years now. If you can do hard things, I know that.
Yeah, I know. You've guided me through all sorts of hard things. And that's actually we've got to share that story. So it's actually the story about why I graduated a little late. But the short version
I'll see you in a few months.
Yeah, right. The short version, I was suspended twice in grad school, and it was a fantastic story. Oh, man, being blamed for other people's mistakes. That's, again,
that's called being a scapegoat.
That is, again, a story for another time, because I can rant, as you know, with that one. But one last question that I wanted to ask before we hop off here. I know that we've taken the listeners on quite a bit of time so far. But to any maybe new grad who just finished chiropractic school or any physician type school, what would you say to that graduate?
Gosh, really, you have to find what resonates inside of you. Listen, I don't like infinity chiropractors, but honestly, if that's your thing, you have to do it. That's your calling. You have to. And don't care about what I think. Listen, chiropractic is extremely powerful. You have to do what resonates with you and what God has put you on this planet to do, irrespective of what I think.
Fantastic. You're saying that they still have agency.
Yeah, I like the way you put that.
Yeah, whether or not you agree with anything that we've said on this podcast, I hope you've learned something. Thank you, Dr. Derek, for joining me this evening on this podcast. For any listeners out there, I hope you learned something new. If you want any specific questions answered by Dr. Derek, how can they reach you?
Advanced Chiropractic and Performance on Instagram at advanced.chiro.perform. Of course, you could Google it. I'm in Little Rock, Arkansas. I'm on Facebook, just not as active. And then info at advancedchiroperform.com.
Perfect.
Instagram's the best way.
You're on the Insta?
Yes.
All righty.
That's why I have bags under my eyes. Doc, I respect you for so many reasons. And I'm so very grateful to what you taught me along the way and what you're doing for your community with this. And bless you, dude. Bless you.
Thank you. Love you, brother. Thanks for spending me some time on this podcast, and we'll talk to you next time. And to the next listeners out there, I hope you tune into the next episode with Dr. Mark Charette as the guest speaker. We'll see you then.